truly appreciate the invite, and good evening, Commissioners and Mayor Pro Tem and the audience. I really love to be able to talk about some of the wonderful things our team at Miners-Colfax Medical Center is doing. I'm going to expand a little bit on just going over what we are doing, including our black lung and our respiratory disease program that was really identified in our strategic initiatives, along with the career pathways and just other great initiatives. So again, I remind everyone, Miners-Colfax Medical Center, we have a history of caring, future of promise, because it is about a future of what we can bring. And we are one organization, even though we provide a lot of different services in many different facilities, and that one mission in one direction. So to remind, we are a 25-bed critical access hospital with a 24/7 emergency department, advanced general surgery, the medical surgical. We are the only intensive care for over 100 miles. We are the only obstetrics for over 100 miles. We have advanced radiology, our laboratory with an on-site pathologist that is unheard of for a facility of our size, and then great respiratory therapy to support those black lung and the miners. Our outpatient clinics, we're in the middle right now, and we'll talk about a little bit, for a new provider-based rural health clinic. And our long-term care facility, which was the original hospital in 1904, is sitting up there on 6th Street. We are ranked in the top 10th percentile for national quality standards, and that's against 3,000 other like facilities. So just a tremendous job that team does. And then, as Mr. Berry talked about, our black lung respiratory disease outreach program, it is nationally recognized. We are the only one of 17 different members in that coalition with that 50-foot semi, travels the entire region, fully digital, full electronic health record, and we have telemedicine capability with that. So the mission, I know it's a little small up there again. We were established part of the Ferguson and the Enabling Act, originally a miners hospital, because you can imagine back then there was no health care coverage, and that's an extremely dangerous, hazardous occupation. So they put aside 100,000 acres to help support the miners hospital. In the mid-'80s, they merged with a county hospital, and now we serve all of northeastern New Mexico. We are State of New Mexico agency, and our mission is truly to be that leader in providing high-quality, acute, long-term primary care, the black lung, and other services for northeastern New Mexico, and all of the beneficiaries of that miners trust. Our values everybody commits to, and probably everybody in this room commits to, right? We commit to teamwork, great communication, exceptional quality, being dependable to our customers and each other, and honest in everything we do. So, as Mr. Berry pointed out, everything we do is lined up with what I say is a strategic pillar. So at the base, that support is all the team members, our wonderful medical staff, the great board of trustees, our phenomenal auxiliary, and the foundation that helps with recruitment and retention. So those pillars are everything we do is guided by those pillars of, again, exceptional quality and phenomenal service, making sure within our team, our people, we continue to grow them. We invest, and we talk about that in career pathways. Through growth, always looking what we need to do. As you know, you have to keep evolving or you're going to die. So we continue in healthcare to look what we need. Then minor services, back in 1904, that's our core principle, and never lose sight of that. Again, for the community, we're here to serve them and identifying those things. And then making sure we have those strong finances interwoven with all those values, ultimately serving the customer, the family visitors, and our service area. So, I did want to talk a little bit about the rural health clinic. We did break ground October 6th, and we estimate completion by July 28th, 2015. And I say by 6 p.m. on that day. But the primary care clinic will house up to 8 new practitioners and 20 plus new team members, new personnel for carrying out that primary care. So what is that rural health clinic? It is going to be attached directly to the front of the hospital. We'll have that link, as you see with the highlight. Great customer flow to those practitioners. And then there will be 21 different treatment areas for advanced, for obstetrics or gynecology, and for other primary care, including family medicine, internal medicine, our nurse practitioners. What the difference with the rural health clinic is, just so everyone knows, is making sure, just like we are a critical access hospital, we get special reimbursement. So this is the same thing, and because of our rural setting, we can get that designation and we get better reimbursement from the federal government on those. So it's not an impact to our customers, but again, financially, it's very lucrative in that way. So I also want to talk about our Northeastern New Mexico Integrated Behavioral Health Coalition. We've talked and we've formed this about a year ago. Erica is in the house, and I appreciate her support. She is part of that team. But Miners Colfax Medical Center, SOI, Tri-County, HSD, Children and Youth Family Services, Justice Department, Colfax County, City of Raton, and the Raton Schools. It's a large group coming together and then looking at how we can improve overall behavioral health for this region and the state. So we did a feasibility study, and the recommended program's initial steps are for a 10-bed geriatric psychiatric unit, a 10-bed adult psychiatric unit, a 20-bed adolescent acute care, and then outpatient services for all the age groups, and continuous development of that integrated behavioral health program. So we continue to work on that, and the preliminary design is to use the old acute care facility that was built in the 70s to create that. So that's where we continue to work with the state and with our collaboration on how to bring that integrated approach here to northeastern New Mexico. All right. So I just reinforce, so everyone really understands, state of New Mexico has a remarkable opportunity to reshape the way behavioral health care is provided. We know there's a huge gap, not only in the state, but nation, and through the collaborative effort and integration, we're going to be able to really be at the forefront, just like we are with our black lung and respiratory. So we are in that extraordinary position, and we will keep moving forward to keep New Mexico healthy and well. So part of that is, again, back to our pillars, minor to minor. So we are working with that 17-member collaboration throughout the nation on what a minor to minor program is to improve minors' health. Because you can imagine minors are afflicted with many, many diseases, including respiratory, black lung, silicosis, those type of things can really impact. So making sure we provide good behavioral and mental health for those. And with that 50-foot semi, we're going to be able to do that throughout all of the state of New Mexico. So, one of the great things Mr. Berry was talking about, we have a tremendous partnership with the University of New Mexico. As you see, Dr. Akshay Sood is a pulmonologist who is a partner with us in our black lung and respiratory. He is recognized now as a national leader in the research around black lung and other associated minors diseases. So what he really looks at is, as he dices up a pie, not to make everyone hungry, but the clinical aspect, the educational, community engagement, and then research and grants. So some of the clinical highlights we've really, gone on, and Candace Evans is spearheading this with Dr. Sood. But we continue to do 4 to 8 specialty clinics here in Raton. We do 8 to 12 mobile outreach clinics, and we'll continue to expand that. We do more B-reads, and what a B-read is actually after they do the x-ray of that minor's lungs, they look if there's any disease states there. Also, cardiac exercise testing, ultrasound placement for arterial lines. That's something, we're the only clinic nationally that does that. We look at lung volume, diffusing capacities, and these are type of things and testing measurements that support the minor's need for benefits. We continue to pilot and participate with uranium miners. Remember, we're just not here for coal miners. We do advanced benefits and counseling. We've gone to several national symposiums on this, and Candace has presented because she has some very best-in-class programs. Future, we continue to increase the number of our clinics here in New Mexico, and through a federal grant that Candace was able to get, we've increased our federal funding from $300,000 to $500,000. So we will be going into Utah, Wyoming, and Montana with that, because the more we can serve, the larger our database, the more research they're going to be able to do. We're going to continue to add blood screening and cardiac risk biomarkers, and what that really means is it's just not the lungs for minors. It's many, many other disease states. This will be able to really zero in other things that affect minors. And we continue to look at advancement in cardiopulmonary exercises and just increasing how we can serve uranium miners and other miners. So this just talks about Dr. Sood, down at the UNM. Because of our satellite connection, he is real time as we're out on the road from Cuesta to Silver City to Carlsbad, wherever. And then we have a nurse practitioner on site, community educator, and that benefits counselor, and an x-ray technician. So accomplishments, we won the award for the quality project and what we're doing. We also just were certified by NIOSH for advanced spirometry. And then Dr. Sood has gone to several national discussions and symposiums on what he's doing, from cardiothoracic to other things, and really recognized as the leader. And why that's important, because Dr. Sood writes, and shows that a minor needs benefits, but the coal companies or the other companies have their, legal team to fight that. But Dr. Sood has all the credibility and credentials. So we are showing high success rate in getting minors their benefits. So we've been recognized nationally for that also. So we continue to do what we call minors community grand rounds, advance our pulmonary function tests, internships with the University of New Mexico, again, because it's a collaborative effort. And then we're looking for greater participation and different abstracts that we submit nationally. That's just one of the places Dr. Sood has gone. We probably want to go to San Diego, but now that's a little cold. All right, other research and grants. Again, part of it is Dr. Sood has been instrumental in getting us more grants. Just real quick highlights. Again, Candace worked with Dr. Sood. We advanced from $300,000 to $500,000. They also just received Tier 2, they received a PCORI grant of $25,000 last year. Now they received the Tier 2 of $50,000. What that is really working with minors on new ways to educate them, to get them enrolled, and to work with them regionally. And we're going to be going after the Tier 3 and our network as we work with Utah, Wyoming, and Montana. Also, I just wanted to point out, because of Dr. Sood's efforts, that final one is the Alpha Foundation. That is a premier grant nationally And well over 200 institutions apply and fight for that, and there's about 20 that they give. And we were just nominated to submit again for more advanced on that, so it's a great thing. So, we continue to go to health fairs, educate. We've developed a wonderful new website with Dave Shaver, one of our key IT people, and we're continuing to look at integrated databases with all those individuals in our coalition. The one thing I wanted to talk to, and I didn't have a slide, I was hoping Janine Peak, who really spearheads our career pathways, is a tremendous program, and we just won the state award out of all rural hospitals throughout the state of New Mexico for this initiative. And what it is, it takes juniors and seniors through a career pathway for healthcare specifically. Now, they follow this, there's in-class education, then they come out into the field and work with our patients, with our nurses, and get mentored. When they do all that curriculum, if they start their junior year and complete it by their senior, they have 18 college credits already completed free. This is a county-run program that helps support it through the school nurse and our community educator, but it's a great thing. They're already certified as certified nurse assistants. Then they have those college credits actually to start into their sophomore year for college. So we're trying to get those individuals into different career paths, not only in healthcare, and we're going to be expanding it to other areas, including finance, marketing, other businesses. So that's a tremendous thing that they're working on. And they're working with Luna College, with Trinidad Junior College on those type of things in a collaboration. Okay? And truly, I appreciate the time today, and really on behalf of those 244 great team members, I appreciate your support throughout the city.
Thank you, Mr. Lerch.
Good evening, City Manager and City Commissioners. It's great to see everybody after a year. I think everybody else was here in full detail when we gave the description, except for the City Manager and our new Commissioner. I made packets that further inform you on what CCJJCAB is. You're welcome. And tonight I'm presenting Colfax County Juvenile Justice Continuum Advisory Board. Erica Meadows has been a great supporter since 2008 and has made huge collaborative efforts in supporting the program. The programs entail Girls Circle, Boys Council, and Restorative Justice programs, and they're all beneficial to our public and to our youth. It was reared in the beginning to serve at high-risk students, and now we're moving towards education and leadership skills and advancing in those areas as well. So we have gotten new curriculum, and we have a total of 6 employees that are contracted under these programs. The agency is SOI, and it's a very small grant. It's at $72,000 currently, but we'd like to increase that. Looking over our numbers over the past year, it's only been 6 months, but going back to 2012 to 2013, June to December, 39 youth were served in Raton, New Mexico. June to December 2013, 67 youth were served. In June to December 2014, we have served 89 youth. And I'm proud to report with all of our feedback surveys and being very present to take observations of the students. There's been increased knowledge in education and leadership skills, and that's going to be the force that we move with to drive on our grant writing for this next 2015-2016 fiscal grant. It's also been very beneficial for restorative justice because that is a program that Erica Meadows can share more information about. It's also reared with CYFD, and referrals come from JPOs.
Hi, our restorative justice program works with our local businesses. So when we have a juvenile that offends, like a shoplifting charge or criminal damage to property, graffiti, things like that, we get them together with the victim, and we do a restorative justice circle. So they get the victim side or the business's side of how it impacted them. You know, a lot of times these kids think, oh, I just painted your window, it's no big deal. They don't understand the ripple effect that that has. And so when you set them in front of a real person that they damaged, that caused harm to, and they explain that to them, it makes a huge impact on those kids. And we also work with them making reparations, so they clean up the graffiti, or you know, they help clean up the store. They do community service with that business, so that even though they can't financially pay back some of the damage, that they're physically paying it back. And so they have an investment in the community, so the next time they're like, oh, you know, they might tell their friends, oh, don't paint that. You know, you gotta clean that up, that's a lot of work. And it doesn't just affect that business, it affects all the businesses around it, it affects the entire community, you know, our tourism, just, you know, community well-being in general. So it's been really beneficial to help those kids. And all these programs are all prevention programs, and they're all pre-prosecution programs. So we can divert kids into these programs rather than sending them through the court system and having them on probation. So I think it's been extremely beneficial to the community. And like she said, you know, over the last 3 to 4 years, we've really grown and reached a lot more kids than we did. And if we can expand the grant this next year, I think we can probably almost double the number of kids that we're reaching.
And in sharing that, I'd like to further collaborate. Girls Circle Boys Council also entails Mother's Daughter, and we'd like to go ahead and include getting referrals from family services and being a preventive program there as well. As far as intervention, we're definitely doing that in our schools. Our strategic plan back in 2012 to 2015 asked for us to increase programs and to expand out into intervention and to go within the schools. We have met all those standards, and in fact, with the alternative school, students receive a half credit that meets New Mexico standard-based criteria, and they receive a half credit for being a part of that. They're also given back to our community by having dodgeball tournaments and extracurricular activities that are positive for our youth, and it's encouraging more youth to participate, and it's just been a great ripple effect. And with outcome and success, a lot of students have made more positive choices. Their grades have increased. They've been becoming more involved in sports and different avenues of that. So it's been a very positive program. It is to create resiliency in our youth and to show them that there is a future ahead of them. So we do a lot of goal setting and things of that sort, and we have a lot of great guest speakers as well. But all of our facilitators currently have been trained professionally, and they are certified to teach in all 3 areas. Do you have any questions?
Questions or comments?
I would like to note that our next 2015-2016 fiscal grant is due December 12th. So we will be bringing the application on the next meeting. And I would also like to share that there is going to be an increased asked amount of $30,000. And I would like to greatly thank the city, especially Michael and Antonucci, for all that she's contributed towards this program. I feel that it is something very positive for our youth, and I've seen great success from it. And it started since 2008, but it has built since then. And where it's at now is almost as great as a training class or even a college course. Thank you.
Last night, there was a very important meeting held at the high school with the Board of Education talking about plans for the building, which New Mexico Highlands will no longer be using after the first of the year. And I want to share with you a concept that actually City Manager Berry put in my mind, is that we really need to have a vision of what it means for Raton to recover economically. And a key part of that is making an investment in education. Our workforce is practically nil. We have jobs that go wanting for lack of a trained workforce. And we're not talking about college degree students. We're talking about what are called middle skilled jobs. People who have graduated from high school, maybe have some first or second year post-high school training. These are making up now 40% of the jobs nationwide, what they call middle skilled jobs. And we simply don't have a workforce prepared to take on those jobs. When new employers come here, it's very hard to sell to them that we will have the workforce that is needed to help them make their business a success in Raton. And we need to reverse that. And one of the ways to do it is to invest in education. We need to have the courage to look forward to what it will take to bring economic success to Raton, and we need to be willing to make an investment in that goal. If not, then we are going to be in a sorry state, I hate to say. But there are good things on the horizon. If we can just be a part of the solution and not a part of the problem, then we can join together and work together to make sure that education is a high priority and that the New Mexico Highlands building is fully utilized and available to our community. Thank you.
Thank you. Item B, or C, excuse me, deliberate and act on resolution 2014-42, the October 2014 financials. Mr. Pettit?
Thank you, Mayor and Commission. I'm going to call on Mrs. Antonucci to give us a discussion of the financial report.
Mayor Pro Tem and Commission, in your packet this evening, I've given you the usual general fund financial summary, and then we've also got the gross receipts tax report for the month of November, our cash flow report, and then copies of our financial statements. So I'll just briefly go over our general fund financial summary for you this evening. Our general fund ending cash, as you can see, as of October 31st, was $684,304.66. I've made a notation on your report, and you can see that when you look at the history on our cash flow report, that typically October and November are our lowest months, and that's just because a large portion of our annual revenues come from property tax, and we will not receive those revenues till late December, early January. So usually after the first of the year, our cash balance will be back to a comfortable level. And so as a result of that, we generally put off any large purchases until after January 1st, unless, of course, it's a necessity or an emergency. Gross receipts for the month of November, they're still down, not quite as much as last month, but we were down 0.76%, which is about $8,813. And so we do anticipate that now that the I-25 project is wrapping up, I believe they've probably completed striping, and we should see some additional GRT from that, and then also the Park Avenue drainage project. But we do anticipate that projects will slow due to the winter months coming up. Is there any questions that you have on our October report?
Any questions from the Commission? Thank you.
Okay, thank you.
Take a moment right at this time to thank Mrs. Antonucci. As you know, I'm on the financial board, and it takes a lot of explaining sometimes to get it to me. She is a real professional in her job, and she does a great job. My kudos to you.
I'll second
At this time, I would entertain a motion to approve resolution 2014-42.
So moved.
Do you have a second?
Second.
Trish, can we have a roll call vote, please?
Commissioner Giacomo,
Yes.
Commissioner Schuster,
Yes.
Commissioner Chavez,
Yes.
Mayor Pro Tem Segala.
Yes. Resolution passes. Item D, deliberate and act on recommendation for bid award for City of Raton multimodal site trench filling and compacting project. Mr. Berry?
Mayor Pro Tem, Commission, this is in regard to the project that has been proposed and discussed for, about 5 years now, in what we refer to as the parking lot on First Street. There has been an extensive environmental assessment of the project, given to the fact that we are in a historical area of town. There are known structures that have been constructed on the site, and specific to the cultural resources survey. So at present, we have recently completed some trenching on the site in that cultural resource fieldwork survey, that's done, it's completed, we are approved to go forward. However, there was not a plan by the design team to recompact those trenches. And since we are building a project on the site, we held up the backfilling of them until we could do that correctly. So I did ask Mr. Phillips to take bids on filling those trenches by a contractor and compacting them to a condition that would be suitable to construct a project on. And I would like to turn it over to Jason Phillips to tell you where we're at on that.
Mayor Pro Tem Commission, we did receive 3 bids for the trench filling and compacting project. The low bid was received by WM Serrazio Construction. We did also receive bids from Farmers and Ranchers Welding and Randy Senna Construction. The low bid is $17,250 plus the New Mexico gross receipts tax, easy for me to say. And the total is $18,619.22 with tax. We have spoke with Greg Heitman of the Federal Highway Administration, who administers the grant funds for this project, and he is considering this an eligible expense as long as we go through the proper procurement, which we have. So we are here tonight recommending award of this project to WM Serrazio.
Thank you. Any questions for Mr. Phillips? I would then entertain a bid.
I'll make a motion to approve the bid award for the city of Raton.
I have a motion. Do we have a second?
I'll second that.
We have a motion and a second. Trish, could we have roll call, please?
Commissioner Schuster?
Yes.
Commissioner Giacomo?
Yes.
Commissioner Chavez?
Yes.
Mayor Pro Tem Zagata?
Yes. Thank you. Let them know. Item E, deliberate and act on legislative priorities. Mr. Berry.
Mayor Pro Tem and Commission, in your packet, I have included the information from the Infrastructure Capital Improvement Plan. This is information that we have looked at and talked about several times, and I would tell the Commission that the state legislature is scheduled to convene its 60-day session starting January 20th. I would like to have a discussion with the Commission tonight about preparing requests for capital outlay from the legislature. And we don't necessarily have to take action tonight, although we made it a possibility on the agenda. We could also do that December 8th. We would then not anticipate a meeting through the rest of December, but between now and December 8th, if we could get some action from the commission on those legislative priorities, myself and the staff will put together that information and get it to the appropriate channels as far as that legislative funding process. So what you have is the Infrastructure Capital Improvement Plan that has been submitted to the state, and we really can't stray very much from this set of priorities that we have here currently. So it's doesn't leave you a lot of flexibility as far as identifying those legislative priorities, because when you go to the legislature, you do want those priorities identified on your ICIP. And then as we get into next year, the ICIP would be something that we talk about throughout the year. We have an opportunity for a lot of public input in regard to that plan, and more, I guess, flexibility for the commission as far as establishing your priorities going forward. But at this point, this is the plan that we have submitted to the state, and I can go through a couple of the top projects here for you real quickly and tell you what we're thinking. So at number 1 on the project, we have listed the transfer station. That is, it would be a new facility that we would consider constructing, and it follows up with Mr. Lewandowski's report to the commission that we saw about a month ago. And Mr. Lewandowski had identified that really with a modern convenience center transfer station, we could greatly increase the percentage of our recycling materials. So now we may be at a couple of percent of our total waste stream that we recycle. You remember Mr. Lewandowski said that you may be able to do multiple times as much volume if we had the correct facility. So one of the issues that we have now with recycling is typically we might go have a commercial recycling pickup with our route truck, we cannot get that route truck into our current recycling facility. It's not designed for that, the doors don't allow for that. So we really have a problem right now establishing that commercial pickup. We depend on individuals bringing recycled material in the car, driving in and depositing those, but we're really missing out on a lot of material that otherwise we would collect. We do see a lot of cardboard and a lot of plastic going out in the waste stream here also. And as Joe explained to you, you really pay twice when you do that. It would be a transfer station that is designed to work with our walking floor trailers that we have invested in. We see a lot greater efficiency. We see less of a regulatory issue with that, and you can see the dollars there. We had planned on investing up to $1.2 million in the facility. So we would go to the legislature and ask for some funding. I would ask them, I would recommend to you that we ask for $750,000 from the current legislature. Second on the list is Lake Maloya dam safety improvements, and I'll go through that real quickly. You can see some large dollars on the back end there, $8 million in total. We have two situations with Lake Maloya currently. There are 4 outlet conduits or pipes through the dam. One of those failed in the 1970s and was filled with grout to prevent leaking. The thing that's so dangerous about a leaking pipe in the middle of the dam is that it will result in internal erosion, one of the riskiest things for an embankment dam, and specifically our dam. We have in the last couple of years discovered that an additional pipe that's also leaking in the center of the dam. It's valved off in the lake, but we need to take steps to rehabilitate that one, plus the remaining 2 conduits that we operate on now, or again, route one if we can't rehabilitate it. So there is a study going on currently. Can't do that when there's ice on the lake, so now, as the Commissioner had said, we will complete that work in the spring, and then we'll do, based on the findings of that, do the rehabilitation work of the conduits. The other big item there, in recent engineering work, we've identified that the spillway capacity is far under the required spillway capacity. So the large dollars that you see would be to plan for, design, and construct spillway improvements that would meet current regulations. So you do see an $8 million price on Maloya over a long term. Very difficult projects there. 3, street reconstruction. I don't think it's a secret to anybody that we have extensive needs as far as maintaining and improving our streets, up to complete reconstruction of many streets. You can see the dollars there over many years, $3.7 million. I would tell you that if we had $50 million, we could make a difference on the streets. With $3.7 million, it's really still inadequate funding, and it's a stretch to see that we're going to get this kind of funding over time. So we really need to set our priorities as far as street reconstruction. In addition, it goes hand in hand with drainage improvements. We have made some this year. We have additional drainage improvements planned. A lot of old infrastructure out there that we would, to really do it right, would take large dollars to correct. And then I'll stop at this item, but a new medical response unit, always a need for us. We do a lot of medical transfers, so we have a lot of wear and tear on our ambulance, and it's always something that we're looking to replace. They go fairly quickly. You have a lengthy list, but those are the top priorities.
Any questions for Mr. Berry, comments? Mr. Berry, I would then entertain a motion that you proceed with the process of getting this submitted to our legislation. So I would entertain a motion on that.
I'll second that motion.
Okay, we have a motion from myself, I guess, and a second from Mr. Chavez. Trish, let's go ahead and roll call vote, please.
Commissioner Chavez?
Yes.
Commissioner Schuster?
Yes.
Commissioner Giacomo,
Yes.
Mayor Pro Tem Sigley.
Yes, thank you. Item F, City Manager's Report.
Thank you, Mayor Pro Tem, Commissioners. I would refer back to our work session on Saturday, November 8th, and the commission, the staff, and citizens present did work on trying to discuss priorities for the city. You had tasked us with several top priorities. They included addressing crime, drug and alcohol abuse in the community. The second, education and job training, beautification, economic development, and capital improvements. And so I think that we have elements from a lot of those priorities represented at the meeting tonight. Hopefully, with the presentations that you've heard from Mr. Jenkins and from Shawn Lerch, we can kind of see that there are some possibilities for Raton. Certainly MCMC has some pretty exciting things planned that could really help the community in the area of economic development. Healthcare is a great attraction to the community, but hand in hand, you have education and job training, which Mr. Jenkins had talked about. And we'll talk about that a little bit more as we go down the list here. But those are things that we began working on, and one of the strategies is, for me and the staff, is to work with other organizations like MCMC, Colfax County, and Raton Schools. So we have done a lot of interaction with those agencies. They have similar goals as we do here. And so we're trying to find those things that we can work on together, and I think we're stronger if we do that. We've also had meetings with Grow Raton, Main Street, the Chamber, in order to try to address some of these things also. So, going down the list, I would tell the commission that I have scheduled a meeting with Lieutenant Governor John Sanchez that will be held December 10th. It will be in Albuquerque, the morning of December 10th, at his office there. And the plan is to discuss the potential for improvement to our airport. And as you know, there is a planned industrial park area with the airport. So we're looking for potential ways that we can develop that area with the state, try to bring in some businesses, and they could be businesses that are transportation related, may benefit from air transportation, our really solid small city airport, or it could be a type of an industrial business that needs to be located away from the population center. So we're going to talk to the Lieutenant Governor about that, see if we can have some ideas. I did ask Mr. Funk to attend the meeting, and I think that they will be represented at the meeting. And so we have the city, the Express Aviation, and the state. We'll see if we can get some momentum going at the airport. We also will talk about other things going on in Raton prior to the legislative session. The following day then, I planned on attending the New Mexico City Management Association Winter Conference, and that will also be in Albuquerque. I did have a phone conversation with District Attorney Donald Gallegos. He had expressed the desire to come to Raton and conduct a public meeting. We did schedule that public meeting for December 17th at 6 p.m. And I haven't told the county this yet, but we would hold that at the County Commission Chambers, which is the old courthouse across the street. So we will firm that up with the county, and Donald, Mr. Gallegos, will be here on December 17th. He will also be here in the morning to go on the radio, and this is part of the effort to address the crime issue and the drug issue in Raton, where we want to work closer between our city police, the sheriff, the district attorney, and the staff at the jail. Those kind of collaboration discussions. So our police chief will be there. He'll talk about his end a little bit. We'll ask the sheriff to address the meeting as well. So the public is invited to that meeting December 17th at 6 p.m. I would like to discuss the RPS Board of Trustees, and I'd like to note that we lost a great trustee in Mark Jansen, who had passed away recently. Mark had really had exceptional service to Raton Public Service for a number of years, both as a trustee and as a board member. Now, at the next meeting, I would ask the commission to consider replacement of that trustee position, because they do meet right after the first of the year in January to vote on the board of directors. So I would notify the public that we would look for applications for an RPS trustee, and we would bring that to the board, to the commission at the December 8th meeting. Going back to the library that Commissioner Giacomo had reported on, we had a leaking pipe incident at the library. It was relatively minor. It is located in the basement, but what we did find out is that there is some very old water pipes in the basement there. And this was kind of a warning, because it looks like we're gonna have big problems with this plumbing in the future. So we are doing an evaluation of really upgrading that plumbing in the basement of the library before we have really a catastrophic leak. But it's old galvanized pipe, I'd say greater than 50 years old. It could be a lot greater than 50 years old, and it's really in poor condition. So we're doing an evaluation of that plumbing now, identify some funding for it, and then try to bring it to the commission to get that plumbing upgraded. There was a lot of material stored in the basement, and if we did have a big leak there, especially when someone wasn't there, maybe on a weekend, it's gonna be a disaster. So we'll be working on that and bringing that to you. Lastly, I did meet with the district engineer, DOT, David Trujillo, in Las Vegas. He gave me an update of the South Interchange project. The project was bid. The bids came in at well over their engineer's estimate, but they realized that the bids are probably not going to get any better. So they just had to go get more funds for the project. They do plan on awarding it to Northern Mountain Construction and doing the construction starting in spring. So that award will be taking place. Also, the DOT was in town for a public hearing in regard to a game fence they proposed to build on both sides of I-25 through Raton. Apparently, there is a great number of accidents involved with wildlife crossing the interstate, and so the proposal is to construct this high game fence. So they updated us on that. That will be coming in the future. That's all I have, Mr. Mayor.
Thank you. Any questions or comments for Mr. Berry?
And what Mr. Berry talked about in the work session that we had on Saturday, and all of the things that were brought up that we talked about, and economic development, which is very important to our community, it connects with each one of the other things that we talked about: education, hospital, school, crime, and working on all these things together, which is starting to take place in Raton. You'll see that some of the things are starting to come together, and if we work those all together, then we will have some good economic development. That's all I wanted to say.
Mr. Giacomo, item G, Mr. Berry, I'll let you address this executive closed session pursuant to NMSA 1015-1-8.
Mayor Pro Tem and Commission, we did schedule this closed session. I'm going to explain that a little bit more, and I'm going to give you a story behind this, but I did want to bring to your attention that we did have an email message from a concerned citizen, and the citizen stated that he felt there was a lack of reasonable specificity on this particular item to go into closed executive session. I wanted to bring that to your attention. Tricia here did talk to Sally Malavi at the Attorney General's office. She's an Assistant Attorney General, and Sally had told us that if we simply provide that specificity at this time, she didn't see any problem with going into a closed session. Now, in the alternative, we can simply schedule that for the December 9th meeting also, but the closed session is proposed to have a discussion and bring the commission up to date with discussions of the Highland University Educational Building / Learning Center. Now, the building is located on Park Avenue and First Street. It's on North First Street, right where South First becomes North First, across from the multimodal parking lot. So that's the building that we're talking about. We do have Mr. John Davidson on hand. Mr. Davidson has been a very active proponent of higher education in Raton, and was instrumental in launching higher education into that building. So we had planned on having Mr. Davidson update you on the potential for higher education going forward in that building. And to skip ahead a little bit, I think we all know that Highlands University has operated a program for higher education out of that building for about the last 5 years, and Highlands has notified the community that they will no longer be doing that they will not have that program in that building anymore, and as a matter of fact, they've already closed up and moved out. So the discussion is what becomes of the building, number one, and what's the potential for higher education in Raton, number two. Now, I would tell you that I did attend a meeting of the Highlands University Board of Regents on November 18th, and the Board of Regents made a decision to talk to the Raton group in their meeting in a closed executive session. So they met with myself, Mr. Davidson, Paul Jenkins, and Janine Peak, who represented MCMC, and we did that in a closed session. So I felt a little uncomfortable in coming to the commission and in an open session and saying, here's what we talked about in a closed session. So to respect the University Board of Regents closed session, I plan on updating you in closed session here as well. Now, that's what it's about, is what becomes of the building. They have no action. It's simply a discussion. There would be action down the road somewhere. We would come back to the commission, have additional discussion, take input from the public, but this is simply to bring you up to speed on what's been discussed so far. So it's your decision if you want to go forward. The Attorney General's office did say that if we state with some specificity why we're going into closed session in regard to acquisition of real property, they would not have a problem with it. We can easily reschedule it for the next meeting as well.
Are we gonna hear from Mr. Davidson this evening?
I would like to ask Mr. Davidson to sit in with us, and Shawn Lerch as well.
Well, then, this time I would entertain a motion that we go into executive closed session pursuant to NMSA 1015-1-8, acquisition of real property, the New Mexico Highlands building. Do I have a motion?
I'll make that motion to pursue, go into closed session, pursue New Mexico SA 1015-1-8.
Do we have a second?
I'll second.
We have a second. Roll call vote, please, Trish.
Commissioner Schuster?
Yes.
Commissioner Chavez?
Yes.
Commissioner Giacomo?
Yes.
Mayor Pro Tem Sagara?
Yes, we're in closed session.